Hey everyone, how are you doing? So the other day I was on YouTube and this video popped up on my feed. This video absolutely infuriated me. It's basically a dentist, I think based in the US, who has a holistic approach. We'll cover this in a second. And she's telling everyone that root canal treatment is an absolutely terrible thing to do and it will cause a whole bunch of effects which we'll come on to in a second. In 2019, Netflix released a documentary called The Root Cause. And again, this was a documentary from a person who had attributed a lot of his general health ailments to having root canal treatments. And in this video, what I want to do is look in a more balanced way about these two arguments. So this lady making this video, she quotes certain types of evidence that has been documented, which links root canal treatments and the bacteria of root canal treatments to general health. And I want to open your eyes to different sources of information which actually suggest the absolute opposite. So in order to understand all of these arguments, I think we need to understand exactly what a root canal treatment is. So here is the anatomy of a tooth. The bit that you see in your mouth is called the crown, and underneath the crown, usually beneath the gum, is the root of the tooth. Okay, so this is just the whole tooth is made of the crown and the root. And inside the tooth, there is something called the root canal. And inside this canal is a blood system. Okay, so blood will go in through what we call the apex of the tooth, and it also comes out of the apex. This is a tiny little hole. So inside the root canal, we've got our blood capillaries, and we have connective tissue in there, and we also have the nerve. Okay, so when people say the nerve of the tooth, they're talking about the root canal, but also there are these other structures inside here. And typically what happens in situations where people might need a root canal treatment is that we've got tooth decay. Tooth decay is basically, let's just say, it's full of bacteria, which it is. Bacteria will enter the crown of the tooth. Okay, so this all happens within the mouth, and it will get deep enough that you start getting a lot of pain and maybe an abscess. Now, the pain and the abscess is caused because the bacteria have entered this root canal, okay, where the nerve lives. And whenever we cut ourselves on our arm or injure ourselves, we always get inflammation. And the same thing happens in this situation. You get bacteria entering, it causes inflammation, which is a normal healing response. But because it happens within a tooth and the tooth is absolutely rock solid, there's no space for this inflammation to go. So the tooth will effectively suffocate itself. This blood supply will stop. And this is the definition of whether the tooth is alive or not, is whether it actually has a blood supply. And us dentists, we like to overcomplicate things, so we call it a vital or a non-vital tooth. A non-vital tooth is a tooth which has got no blood supply. And if you've been to a dentist and they've done tests, quite often they'll put something cold on the tooth, and that is to see if you feel it. If the nerve inside the tooth has a blood supply, you're likely to feel that cold sensation. Whereas if the nerve has been killed because of the lack of blood supply, then you're not going to feel it when something cold is put on there. And the cold test is just one of a few tests. You can actually use hot water. So different sensations from hot to cold. There's actually something called an electric pulp tester, which you just supply a very gentle electric current and gradually increase it until you feel it or you don't feel it. Or something which I've done a few times, it sounds brutal, but sometimes it's really the only option, is something called a test cavity. So you start drilling the tooth and to see if the patient feels it. This is done without anesthetic. Okay, now the point is there is no one test which is perfect. That's why we've got a multitude of different tests available. Now, this lady in her video, her first argument was that people come and see her and some people need root canal treatment and some people don't need root canal treatment. This has got nothing to do with whether root canal treatment is a good or a bad thing. This is to do with the diagnosis of the root canal. In the UK, the vast majority of treatment is done under the NHS. NHS dentists are very time scarce, and they can only really do 1, maximum 2 of these tests. Now, quite often, I will meet up with a friend of mine who is an endodontist. An endodontist is a specialist dentist. All he does is root canal treatments. And casually, we're talking about work, and he'll tell me about cases where he's seen patients who've come in, they've been referred for a root canal treatment, and these patients don't need a root canal treatment because he's done all these thorough tests and he's therefore concluded that the tooth is actually still vital, although the responses from this tooth might be diminished. Okay, so in those cases, root canal treatment is absolutely not needed. This lady made the same point, but in a very different, convoluted way. Now, she identifies as a holistic dentist. I think holistic dentists are dentists and we share the same belief system in the vast majority of things, but there are certain elements where we do disagree quite a lot, and I think root canal treatment is one of those. So let's look at the arguments a holistic dentist would make against having root canal treatment. And number one is they trap bacteria, and this causes long-term health effects. Okay, and this comes from the idea when we're cleaning out a tooth, when we're cleaning out the nerve canal system, it's impossible to make it 100% sterile. Okay, I 100% agree with this. And that's because the nerve canal system is much more complicated than you see in this image here. There are multiple canals. Canals can be multiple different shapes, and it takes a lot of skill. This is why we don't actually do root canal treatments in our practice. And everyone who needs a root canal treatment will go and see my friend who is a specialist in root canal treatments, because it is a very complicated field. Now, when I qualified as a dentist, I was taught how to do root canal treatments, and most dentists will do root canal treatments, and that's because the vast majority of root canal treatments are kind of straightforward. But the reason we don't do it is because patients typically find us because they want to have the best quality of care, and my personal specialist field is aesthetics and implants, and doing root canal treatment is just something out of my scope. I'll be just doing too many things, spreading myself too thinly. I think my patients would get a much better result if they saw my specialist friend who all he does is root canal treatments, and that seems to work well for us. So even when my friend does this and he's got specialist microscopes, he's got all the gear for doing a root canal treatment really well, will he get that tooth to be completely sterile? No, he won't, okay? Bacteria are tiny, you're always going to leave something behind. But does that cause a problem? We're going to discuss this soon. Another big argument that holistic dentists will make is that because this tissue has been left inside the root canal system, that this is going to lead to systemic effects. Okay, and systemic effects basically means ailments in the whole body. Systemic just means the whole body. Okay, and there have been arguments to it causing cancer, arthritis, autoimmune conditions, and I'll show you where these ideas came from in a minute. And they also believe that now the tooth is non-vital, i.e. without blood supply, and dead, that this can cause an inflammatory reaction as well. And they believe that it's better to remove a tooth rather than having a root canal treatment and replace it with an implant, typically a ceramic implant. So where did all these ideologies come from? Well, they all stem from the work of Dr. Weston A. Price, okay, in the 20th century, so it's quite old. And there's a lot of work that this guy did, and some of it is 100% legitimate. Okay, he formulated a link between diet and orthodontic crowding and general health as well as dental health. He was a big advocate for whole foods as opposed to ultra processed foods, and this was ahead of his time. He nailed that. He got it spot on. Some of his other work has been extremely controversial. So he believed that there was a link between root canal treatment and all these physical ailments, you know, the arthritis, the cancer, all these horrible treatments. And when we start talking about these treatments, they're very emotive. And And some people will form a link themselves, right? Like the guy who did the Netflix documentary. He's got these ailments, and then he'll somehow track back and say, well, it's caused by these root canal treatments. And then I got rid of my root canal treatments and suddenly I'm a lot better. This is not how science works, okay? This is a sample of one person. So at best, the sample rate is just too small, okay? And there is a placebo effect as well, okay? This is really well documented. If you're feeling ill and you take a sugar tablet, okay, just a placebo, which has no medical benefits, you take that and a lot of people will feel better, even if they know that they are taking a placebo. And also, just the way the human body reacts, you might just feel better. You took the sugar pill, but you just feel better just because the body heals, okay? And it's a self-limiting condition. So we need to be very careful when we're looking at anecdotal evidence. So what studies do we have here, okay? And a study is basically an experiment that anyone should be able to conduct with the same environment and reproduce the same results time and time again. And this is where the work of Weston A. Price falls down a lot. His work has been criticized heavily for a number of reasons. Number one, there was no controls, okay? And the control is basically like this whole placebo thing. If you got 100 people and they've all got the same kind of illness, right? And you gave them 50% of them a placebo and 50% an active drug, okay? You would compare the two. The people with the placebo are the control in this group. So Dr. Prince's studies didn't have these controls. They were heavily focused on what he sees day to day, okay? And this, in the whole scheme of things, is the worst kind of evidence. So you see, when we're conducting scientific studies, we can actually grade them from, and I think there's like 5 different levels. It's been a long time since I looked at this. And the best study, the best kind of experiment you can do to eliminate almost any bias is called, confusingly, an RCT, okay? I say this is confusing because RCT also stands for Root Canal Treatment, but that's not what we're talking about here. In the world of studies, RCT stands for Randomized Controlled Trial. Now these are really rare, okay, because they're really difficult to do, they're very expensive, and they're extremely time consuming. Now, if we look at the other end of the scale, the least reliable study would be anecdotal evidence. What do I see in day-to-day practice? Okay, and one example of this, and I've made videos about this and they've been controversial, is that people who go abroad to have dental treatment done. In our practice, we see the disaster cases. Okay, we see these disaster cases all the time. But does this mean that everybody who goes abroad has a disaster? Okay, the truth is probably not, but I don't see them. So my view of the world is skewed in a certain way. What this means is, what we do see is just a tiny little part of the bigger picture. And this is why anecdotal evidence is the least reliable source of actual evidence. If you're really interested in finding what the truth and what the truth is about a subject, you can't rely on somebody's opinion. Some of the other controversial stuff was that Price would remove human teeth which have had a root canal treatment, place them under the skin of a rabbit and claim that that rabbit would develop the same diseases as the human, okay? Now this is completely unplausible. As soon as you take a cross species, even the same species, right? If I was to take a tooth from one patient and put it under the skin of a tooth of another patient, they would get an immune reaction. The body knows it's not their stuff. And if you're crossing species, this is going to be way more exaggerated. And at the time of Price's work, there was no understanding of the biofilm, which is a film that covers all the hard and soft tissues in the mouth. There was little understanding of anaerobic bacteria or the body's immune tolerance. In addition, we haven't been able to reproduce any of his work or any of his results using modern scientific techniques. But even after all of this, his work is commonly cited as evidence to basically back up a point. Now, because his scientific methods were so flawed, they've been heavily criticized by the American Dental Association and the American Association of Endodontists. and it's widely considered that root canal treatment, or endodontics, is a very safe and reliable treatment, especially if it's done well. Okay, and this is why I will send all of our cases to a specialist endodontist, because it is a complicated treatment. But do we have any modern studies which will actually back up the fact that root canal treatment is safe? Well, turns out we do. A major study in JAMA, which I'll link to below, oncology, in 2013 found no increased risk of cancer in people who had root canals. Okay, in fact, some had a lower risk of certain cancers, such as head and neck cancers. Studies using large health databases from Scandinavia or the US have found no strong links between root canal treatment and systemic illnesses. There have also been some what's called case control studies, and this is where we compare a large number of people with a certain disease, say heart disease or a specific cancer, to those without that, and we check the dental history, and most have shown no causal relationship. Okay, I say most, I don't know every single study, and a lot of this information I've actually just scoured the internet. This isn't my field day to day. And there's been microbiological studies and molecular studies, and these show that bacteria can persist in the root canal system of root canal treated teeth, but they're in such low amounts that it doesn't cause an ongoing problem. Okay, and this is a general disease principle. Okay, to get ill, let's say from a common cold, you don't need exposure to the virus that causes a common cold. You need that exposure to a certain level. In our mouth, we have bacteria. We have bacteria that could potentially kill us. However, it's in such low amounts and is kept in check that it doesn't cause a problem. Now, I've done videos on just brushing techniques and gum disease, and this is where the bacteria changes over time because the teeth aren't being cleaned properly, and basically you turn the environment from an environment where everything's in balance to an environment where harmful bacteria can proliferate, and this is what causes gum disease. Okay, we all have the bacteria for gum disease, but we keep everything in balance. Well, the vast majority of us will be able to keep things in balance so that it doesn't actually cause a problem. So the small amount of bacteria which do remain in a root canal treated teeth shouldn't cause a problem, especially if you're fit and healthy. But what if you don't have a root canal treatment? Let's say a tooth is dead and your dentist points at an area of infection. What's actually going on there? Well, it's kind of interesting. So what I'll do, I'll jump to a computer and we can have a look at this. Now, the body's quite clever, okay, in that it knows that there's bacteria, they release toxins, this is a bad thing, okay? And the body is going to try and fight this imbalance, and it sends all the neutrophils, all your white blood cells, which are the cells involved in your immune reaction, to this area, and it starts fighting because the bone has blood supply. Okay, so all these good cells, they are coming here, and we've got this area. It's almost like a little battleground, okay, where the bad bacteria and the good guys, they're all fighting each other, and it forms this hard line, okay? And this hard line has got a hard, dense bone around it. So the body's almost saying, hey, look, bacteria, we know you're here, but this is the defense wall that we're going to set up, and you're going to stay on your side, okay? So the bone that used to be in that area, that the body kind of eats that away. The good blood cells are all in there, and you end up with this area of balance again. Okay, so I've shown you all of these areas on this X-ray, and we've got what, 1, 2, 3, 4, 5 teeth, possibly 6 is drawn like that, 6 teeth, which need root canal treatments, of which only one is occasionally hurting and causing symptoms. Okay, all the others were actually incidental findings. This patient didn't know that they had these problems. We took the X-ray and we found all of these just sitting there. He doesn't have any systemic issues. this all these areas of infection are just there. They're kind of well corticated. That's what we call it. That's what we call it when the bone forms around these infections. Okay, so the point is there's always a balancing act. Okay, and with this one here, okay, which does cause symptoms, sometimes the bacteria start to win and we start getting pain and discomfort and symptoms from there. Sometimes the body can take over, maybe with the help of antibiotics, and it calms it all down to a point where it's no longer causing such severe symptoms. Now, I would never recommend leaving this situation where you have an untreated root canal system which is proliferating larger amounts of bacteria and causing these black areas. If you have a root canal treatment, it brings the bugs down to a certain level where it's no longer a problem. The bone then eventually heals, and these black areas we can see on this x-ray get smaller and smaller and smaller as the bone heals. But what about that Netflix documentary? Well, within a few months of it being released, it was quietly pulled from the Netflix library because of so many complaints from the American Dental Association and other regulatory bodies that they are effectively spreading misinformation with such an emotive treatment like that. As soon as you start blaming something like root canal treatment for a cancer or some other very significant diseases, you're going to scare a lot of people and they will make the wrong decision. And as for the argument that it's better to remove a tooth and put an implant in, I've made so many videos about dental implantology. Okay, this is my specialist subject. As soon as you remove a tooth, you don't just remove the tooth, you don't lose a tooth, your body will react, you'll lose bone around that tooth where the tooth was. So if you want to replace it, you're going to have to rebuild the bone in a lot of situations and have a dental implant. Dental implants might not last forever. In fact, I got a call the other day, someone who had an implant placed about 10 years ago, the implant cracked. Stuff happens, right? If you buy a car and you spend £100,000 on a car, 5 years later, if there's a problem with something, you know what? You're going to have to pay for it. There will be a problem. It's not a correlation to how much you spend on something and how long it's going to last. Nothing is guaranteed. Okay, all we've got is a selection of treatments and a whole bunch of evidence to back up each treatment to suggest whether it's a good one or not. But also, I wouldn't Google a specialist root canal dentist in your area either, because root canal is a part of a larger treatment plan. So the bottom line is, if you need a root canal treatment, if it was me, I would have it done. Okay, if you can save that tooth, it's always better to save the tooth than to pull it out and consider an implant, even if you're having a ceramic implant. I mean, I've made a video on ceramic implants and their shortcomings compared to a traditional titanium implant. An implant is the last resort when you can't save a tooth. Okay, it's a fantastic life-changing treatment in those situations, but I would prefer to keep hold of my teeth for as long as possible. So as always, guys, if you found this video useful, thumbs up, give it a like. Let me know what you think, okay? Whether you agree or disagree with any of the points that I made in this video. And until next time, take care.